because I'm concerned that as we roll out these vaccines in large numbers, we're going to see more and more events occur coincidental in time. And I talked about that last week. And I heard from a number of you that will help me understand that. How will we really know if an event is associated with the vaccine or not? Well, let me just share a story with you that I think helps set some of the tone. A friend and colleague, Dr. Paul Offit, someone who is known to many of you on this podcast as a pediatrician, who's also the chief of infectious diseases and director of vaccine education at the University of Pennsylvania School of Medicine. Paul is a giant in the business. He's written about the whole issue of vaccine safety extensively. His book, Autism's False Prophets, a very important book. And Paul actually tells a story in his writings that I think is very informative relative to what I'm talking about. And he wrote, there's a story that I tell because I think it's a powerful one. My wife, meaning Paul's wife, is a privately practicing pediatrician in the suburbs. And she was in the office one day, and there was a 4-month-old sitting on her mother's lap. And my wife was drawing a vaccine into a syringe that she was about to give the child. But while she was drawing the vaccine into the syringe, the child had a seizure and actually went on to have a permanent seizure disorder, epilepsy. And there had been a family history of epilepsy, so she was certainly at risk for that. If my wife had given that vaccine 5 minutes earlier, imagine what would have happened. I think there's no amount of statistical data in the world that would have convinced the mother that anything other than the vaccine caused the seizure, because I think these sort of emotional events are very hard to argue against. That's the kind of event we have to anticipate and plan for. And when I say plan for, I mean we owe it to the public, owe it to me and my family to know that this vaccine safety is being constantly monitored. As I mentioned last week, and this is where the questions came in, people were somewhat surprised to learn that, in fact, every day in this world, a number of bad things happen to people just by being alive. The examples I gave last week, for example, was if you vaccinated 10 million people in a week, as you know, we are going to try to get very large numbers of people vaccinated. If you look at the incidence of heart attacks in various age populations, it's quite remarkable to find out that, for example, in 55 to 64-year-olds, you could expect in the 1 week after vaccinating 10 million people, that 793 people would have a heart attack just by chance alone. Now imagine my father, my mother, my friend has a heart attack 24 hours after vaccination. I put that on social media and say, oh, I think there's something going on here. And then somebody reads that and says, oh my, I had the same thing happen. It was at 48 hours. And somebody else picks up out of those 793 and says, well, that's nothing. Mine happened in 12 hours. And pretty soon you have a story. And pretty soon you have a crisis. Because we know that we would expect to see many, many more heart attacks than just those 3 or 4 or 5. So one of the things we have to be mindful of going forward is how are we going to address the issues of vaccine safety in this new vaccine world and among a group that are hesitant, if not skeptical. And so one of the things that will be a very important task of the federal government, the FDA, the CDC, going forward is to help us have the kind of emergency response teams that can address these issues as they come up, that they look carefully at all aspects of what that particular adverse event might be. Could it have had any relationship to the vaccine? I'm convinced, just as I just pointed out on the issue of heart attacks, that the vast majority of these that will occur will be able to show clearly had nothing to do with the vaccine. And for this purpose, I believe at this point, there's no reason to think that someone who had a heart attack would actually have acquired it as a result of getting the vaccine. Now, I just want to leave you with one last number because even this, I think, surprises most people. Take that same 55 to 64-year-old age group and vaccinate them again, 10 million of them, And you would expect 1,705 of them, make that clear, 1,705 of them to die in the next 7 days. All-cause death, nothing to do with vaccine. That's just by chance alone what you'd expect to see in this country. So what we need is patience. We need understanding. We need the media to understand this so that we don't see irresponsible reporting that comes out that leaves people with the sense that somehow, oh my, look what this vaccine is doing. And that's going to be a very, very important part of what we're doing going forward.
So even though it's